So I'm just recording this for my YouTube channel. You all can see all the videos. There's a lot of dissection videos. Okay. So once we start dissecting, this is a window dissection of cubital fossa. Here we did this just to understand the difference between various structures. Alright. So first, this is the skin layer which we have reflected. We made a midline incision, reflected skin. Then we have reflected superficial fascia. You can see that this is all superficial fascia. Along with that, there is deep fascia deep to that. Okay. So while we are reflecting, we got this cutaneous veins. Here you can see the median cubital vein, okay, which is a cutaneous vein. So easily we can see that it is a cutaneous vein which is present in the superficial fascia. Alright. Now we are just reflecting superficial fascia, keeping this vein to the other side so that we can see the deeper structures. Here we cleared out the fascia covering the muscle. This is a very specific area to identify all the structures at once. So here we are looking at the muscle. Okay, we can see the tendon, we can feel the tendon. Okay, it's very tough. So we can see this is a biceps muscle, bicipital tendon. Okay, little bit more clearing of this area revealed all the deeper structures. We can see the artery. See here, this is the artery, this is the vein, and this is the nerve. As of now, let us clearly understand how these structures feel under our fingers or using a forceps. Always hold any structure with a blunt forceps. Alright, this is a biceps tendon. We can feel it's very hard structure. Okay, it's very tough. So you should be able to make out the difference between how a muscle feels and how a tendon feels. Then see, look at the artery. Just take the artery separately. You can see that when you palpate or when you use a blunt forceps to hold the artery, there's a cavity present inside, and it's a patent structure. That means when you press the artery, it comes back again. Okay, it comes back to normal shape because it is a patent structure. So there's a canal inside, there's a cavity inside. Now if you look at the vein, this is the vein. When you hold and press the vein, it remains as it is because it is not patent. The walls are collapsible. So when you feel the vein with your fingers, the same thing happens. You can feel that there is a cavity inside, but when you press it, it is collapsible. Alright. So you can make out the difference between artery and vein. Now let us keep these structures aside and try to hold the nerve. Okay, see here, this is a best area to understand all the structures in detail because even the structures are very big and very clearly visible. See the nerve. So when you hold the nerve, it feels like a cord-like structure. Okay, there is no canal inside or a cavity inside. It's made up of all nerve fibers. So you can clearly make out that there are nerve fibers inside it, and it is cord-like, thread-like structures which you can feel under your fingers or your forceps. Okay, so this is how you can make out the difference: muscle, tendon, artery. This is the artery, this is a vein, and a nerve. Okay, all right.